For the last probably almost 2 years before I started physical therapy, I had literally no life.
So then when just one game it happens and I end up in the bottom of a pile of guys, and when I got up and went to move my right arm, hey, this doesn't, I didn't even feel it, I didn't even know. And when I went to move my arm is when I realized, hey, there's something wrong here.
I would have pain in my shoulders and in my neck to the point where it would cause me to have a headache. It's almost like you feel like your head is too heavy for your shoulders.
People live with chronic pain because it's a lot easier to make excuses about it. We can always blame it on the weather, we can always blame it on bad genetics, we can always blame it on an injury from many years ago, and I've always had a bad back or I've always had a bad knee. It's much easier to explain it away than it is to actually take care of it. The problem is that we do that for years and years and years and years, and rarely does that problem ever get better.
I was a swim coach, and my life pretty much revolved around my family and swimming. We spent most of our time in a pool or on the deck, swimming or screaming or instructing. One day I decided I was going to clean the outside of my house, and I got a bucket and a sponge and a hose and went to it. The job was a little bigger than what I probably should have tackled, and about a week later I was in the hospital having surgery because I had slipped some discs. I now have bone on bone, and I've had degeneration in the neck and in the back. I developed a lot of pain, was unable to turn my head. I would have pain in my shoulders and in my neck to the point where it would cause me to have a headache. It's almost like you feel like your head is too heavy for your shoulders. And a lot of times the only way you could get relief would be to lay down. My knee would lock up when I would go to get out of a chair. A lot of times I would have to push up with my hand or support myself on the one side to get out of the chair. When I would go into a room and sit down, I would always look around to make sure there was something nearby so that I could brace myself to get up.
I had the freedom once I realized that, I'd been a caregiver for Ed for so long before he died, and so I had all this freedom to do whatever. I even got a little part-time job. I thought, maybe getting out and being with people, since I don't have Ed anymore and I'm so lost because I'm not giving care to him. And so I got a little job in the Weiss market, being a checker. I love to talk, so I talk to everybody. Well, it was at the Weiss market, and something happened to me, and I thought, oh, something's terribly wrong. Well, I had had a stroke.
Been playing hockey since I've been in junior high. I work as a state police dispatcher, and I've been a volunteer fireman. This year will be 25 years. Yeah, most of the team that I play on, it's all a bunch of cops or firemen from the area. And that's kind of how you would get on this team, is because everybody knows everybody else. So then when just one game it happens and I end up in the bottom of a pile of guys, and when I got up and went to move my right arm, hey, this doesn't, I didn't even feel it, I didn't even know. And when I went to move my arm is when I realized, hey, there's something wrong here. My cousin, who's also on my team, is also a firefighter with me, takes me over to the ER, and they take their x-rays, and yeah, it was dislocated. It was about 3 inches down and an inch forward. So that wasn't fun. It was very painful.
Pain is information, and when people get pain, there are 3 things that they can do. The first thing is they can ignore it, and that's explain it away, or like in Jody's case, when she was having pain turning her head to the left, she had pain. So naturally, what would she do? Stop moving her head to the left. So she ended up turning her whole body every time that she had to look to the left while she was driving. Much easier to do than to actually take care of the problem. The second thing that we can do is we can try to change it or modify it. And the example classically with that is pain medication. Nobody says that pain medication causes healing, but we take pain medications all the time because it distorts that that uncomfortable sensation of pain that we feel. The third thing we can do is we can handle it.
I started to see an arthritis specialist. He was encouraging me to go for therapy, and I put it off for a long time. I had taken therapy other places, and I didn't have the results that I would have liked to have. I felt sort of like it was a waste of my time. So when I started with Madden, I really didn't go into it with a positive attitude.
So I had to go in the hospital, and I had to have a pretty big operation, and I mean, you don't know until something like that happens to you how much you just take for granted. Suddenly I talked funny, I had holes in my head, Swiss cheese head. And you know, I would forget things, and I couldn't drive the car. So that was the kind of life I lived for almost 2 years. I was in and out of the hospital. I had complications from medication. I had kidney disease. Everything just kind of went kaflooey. And I was in the shower, having a shower, and something happened, and I fell out of the shower onto the floor, hit my head on the washing machine. I had no idea what happened. The water was running, the shower curtain was on the floor, I was on the floor. I thought, what happened?
With the firefighting, with my shoulder injury, wearing an air pack, that puts a lot of weight and strain on the shoulders. It's very physically demanding, you know, dragging stuff, pushing stuff, cutting stuff. You know, climbing up and down ladders. So it's physically demanding to where you can't have one of your extremities, you know, not work very well. Same with the hockey. I mean, if you can't move your arms and can't move your feet, then you know you can't play the level of hockey that I play at. I mean, it was very limited. A lot of stuff, you know, I couldn't do around the house that, you know, my wife would have to do. Just, you know, even, you know, pushing a vacuum, you know, that gave me problems. You know, carrying stuff, doing whatever I needed to do around the house, you know, was very limited. You know, the first couple of weeks trying to even, you know, dress myself, you know, dress Sammy and get her ready to go off to school or whatever, you know, very limited.
One of the recent trends in healthcare is that people are taking more and more responsibility for their own care. So the one thing that they can do, and the one thing that has happened in Pennsylvania recently, is people can go to a physical therapist without first going to their doctor. At Madden Physical Therapy, our policy is that the physical therapist we will do the evaluation, whether the script is there or not, but we always communicate back to the doctor and work as a team member to provide the best care for the patient and to get them better as quickly as possible. Another
guy from my fire company who's a retired city firefighter, he had come out here for physical therapy, and Terry said, you know, you gotta go out to Madden. The doctor I went to is associated with another group that has their own physical therapy, but you know, Terry said about come out here, and I need to be out here.
For the last probably almost 2 years before I started physical therapy, I had literally no life. I was not able to walk for any length of time. I was not able to do my routine household chores, and after a while I just stopped. I couldn't do anything, and I went into the mindset that, you know, my life is over. You lose your independence. I mean, the more you stop doing, the harder it is to do anything, to the point that you become sort of a prisoner in your own house. I went and told my doctor, isn't there something we can do to help me to get more confidence and independence again? And that's when she said we could do physical therapy. We can try that. And I said, okay. I said, I'm willing to do anything. I said, I didn't have a good experience with physical therapy a year ago. I said, but I'll try. I said, if you think.
I didn't want to have surgery again if I could prevent it. So I gave in and made the call to Madden. And within a week, I was already starting to feel relief in my neck After a week of therapy, I felt like I had grown. I was walking straighter, my posture had changed, and I really did think I grew about 2 inches.